Hello, and welcome to part 2 of this roundtable discussion from BGI Genomics on managing hereditary cancer within families. Our guests are Dr. Ahmet Uludağ from NGC Genetic Diseases Evaluation Center and Professor Gary Liu from Southern China Medical University. In this video, we'll be exploring the impact of personalized management on the diagnosis and treatment of hereditary cancers, and the increasing adoption of genetic testing for hereditary cancer by patients, and the role of healthcare providers in guiding patients through decision-making processes, helping them comprehend test results and interpret outcomes. Our guests will also elaborate on the pivotal role played by BGI in cancer studies, particularly its contribution to olaparib's approval by the US FDA in January 2018. We're also going to discuss genetic counselling strategies for individuals concerned about their family history of hereditary cancer. Join us in this enlightening discussion as we navigate the complex landscape of hereditary cancer testing and management, seeking solutions that empower individuals, families, and healthcare providers alike. Professor Liu, how does personalized management affect the way you diagnose and treat hereditary cancers?
For this kind of patients with BGI has HRD score tested in mainland China, and the status of homologous recombination deficiency called the HRD is one of the key factors for the evaluation of the PARPD inhibitor deficiency. So, which will be help the doctors to determine whether the PARPD inhibitor drugs would be good for the patient, and HRD score tested could guide the physician in PARP the inhibitor treatment, especially for ovarian cancer. There are so many the report or so many papers published about the HRD tests that are associated with the ovarian cancer treatment.
So we were talking before about how the guidelines for who should be tested are getting more liberal, getting wider. There's going to be more and more patients getting genetic tests for hereditary cancer. What should doctors do to guide all of these additional patients that are being tested through the decision-making process? And how should they advise them to understand the test reports and the different outcomes that they might see, positive outcome, negative outcome, and particularly the VUS, variants of uncertain significance?
That's very important. I think the interpretation for test results is the key point for genetic testing for hereditary cancer family. Positive results are easy for diagnosis, while the VUS is challenging. It should be carefully interpreted. And family cancer history is important, whereas clinical features information such as age when the patients have cancer, multiple cancers in the family or in the patients bilaterally the patient cancers in the like a breast in one side or two sides. Rare cases is also important for the indication for the hereditary cancer. It's also is very important. So for the test, negative or positive or variant of or US and associated with the family history analysis is very important. In practical, I have a clinic for cancer, hereditary cancer, and sometimes the patient bring the report to me and variant of uncertain significance. And so I'm very careful to analyze, to explain the patient according to their family. I need to have their family history, the patient clinical features in analysis is very important.
And genetic testing for hereditary cancer is becoming more common and common in nowadays, but we have to do it very carefully and we have to do it right. First, as clinicians, we have to explain the purpose of the test to the patients. and we have to discuss it with patients why genetic testing for hereditary cancer is being recommended and what information it can provide. We have to discuss the potential outcomes also. Patients should be informed about the possible results of the test, including positive, negative, and VUS findings, WUS findings. And we have to provide support, and also we have to collaborate with genetic counselors, of course. And for a variant of insignificant, I really recommend yearly controls for the patients to check the databases and to evaluate the specific variant of insignificant. And today I had a patient, she had a WUS variant, and we saw that this year that variant became too benign. So we informed that to the patient, and she is now okay, and she's very happy with the test. Before the test, I uh, I told the patient that we can have WUS variants, and those variants have to be evaluated in the time. And after this evaluation, we will inform you, and we informed her, and she is happy now.
So, BGI was selected as the central lab for a cancer study with AstraZeneca, the data from which contributed to the FDA approval of olaparib in January 2018. Professor Liu, can you tell us about the unique advantages and capabilities of BGI Genomics that made it such a good choice, to run that test?
Yeah, let me talking about this. And BGI Genomics provides a comprehensive hereditary cancer panels that include the 90 genes associated with the 20 type of hereditary cancers. Those panels are allowed for a comprehensive analysis for genetic mutation and provide valuable information for risk assessment, diagnosis, and treatment planning, such as the detailed risk assessment and risk management information presented in genetic testing report from BGI Genomics. Experts in sequencing and data analysis would ensure the detection of various types of genetic mutations. That is very important, including single nucleotide variant insertion, detect deletion, and couple number variants. And this is very complicated. For now, BGI Genomics has finished more than 40,000 Black 1 and Black 2 testing. And also, VUS rate of Black 1, Black 2 testing is down to 4% in ovarian cancer. The ovarian cancer and breast cancer is very common in the woman, so including hereditary type. It's a large-scale testing capacity to enable a high volume of samples efficiently. And it also has the strict quality management system to ensure the authorized testing, the genetic testing result. And I have been working closely with the BGI, and also now I introduce, I recommend so many patients for the genetic test for hereditary cancer family. And it is true. And BGI testing and the panel have different panel according to what time the patient and family is can be selected.
So, we talked earlier about families who know they have potential hereditary cancers. But how do you approach genetic counseling for people who are worried about their family history of hereditary cancers, particularly if maybe they're not sure about their full family histories?
Genetic counseling plays a very important role for individuals who are concerned that they have a family history of hereditary cancer risk. In such cases, genetic counselors try to determine the individual's cancer risk by examining the family history in detail. They also provide guidance and performing genetic testing and interpreting the results, of course. And after genetic counselors determine an individual's cancer risk, they perform a personalized risk assessment based on genetic test results. As a result of this evaluation, they provide information to the individual about the measures he can take to reduce the risk of cancer. They also help family members determine the risk of cancer in the family by making recommendations for genetic testing. Genetic counseling services play an important role in listening to the individual's concerns, of course, supporting them, and providing information. In this way, individuals' concerns about cancer risk in the family are reduced and they are helped to make more informed decisions.
Let me uh, tell some of my experience for the genetic counseling. Cancer genetics counseling is very important. It's a bridge for genetic hereditary cancer control management. And because the hereditary cancer control involves so many different, at least five fields from different professionals. And for the cancer genetic counseling, the focus is the three uh, important fields. One is a professional counseling. Professional counseling is about what type of cancer and what type of genetic mutation and associated with the treatment and prognosis, and this is the professional counseling, and it's similar to the sporadic cancer, but which is have a different. It's like I mentioned before, and different type of secondary, primary cancer is happen. It's very important to tell them how to monitor. The second thing is a psychological counseling, because the patient once they have a cancer, even though it is sporadic cancer, they are have a very strong psychologist feeling, and how to guide, how to help them in psychotic with the psychologist counseling. This is very important. If the patient have a good feeling and face to everything, the results is very good. The treatment is results are very good. The third thing is ethical counseling. Ethical is very important, and different society, different country, and different system have a different ethical. And so, and like in China, I have been working in the United States for cancer genetics since 1996. But after I come back in China, when I do cancer genetic counseling is different in ethical. What kind of ethical counseling is different?
Yeah, that's interesting. So another uh, another trend that's changing this landscape in recent years are direct-to-consumer genetic tests that patients can access directly. How does this change the approach that you have to take as doctors, and what measures can healthcare providers adopt to make sure that patients are getting precise and relevant information about their potential hereditary cancer risks?
Healthcare providers can take several measures to ensure that their patients receive precise and relevant information concerning the risk of hereditary cancer from direct to consumer genetic testing. First, healthcare providers can offer genetic counseling service to patients before and they undergo genetic testing. This can help patients understand the implications of their test results and make informed decisions about their healthcare. And second, healthcare providers can stay updated on the latest research and guidelines related to hereditary cancer risk assessment and genetic testing. This can help them interpret test results accurately and provide appropriate recommendations to their patients. And third, healthcare providers can collaborate with genetic specialists and other healthcare professionals to ensure comprehensive care for patients undergoing genetic testing for hereditary cancer risk. Additionally, healthcare providers can educate their patients about the limitations of direct to consumer genetic testing and importance of consulting with a healthcare professional or genetic counselor for proper interpretation of the test results.
Yeah, very good. And genetic counseling is very important, and correct interpretation of the test results is also very important and challenging. And family cancer history and its member genetic testing also is very important. How to guide to help them to accept the genetic testing, and very important, especially in China, in the country, and so because sometimes the family member who don't know what the test is importance, and so they generally do refuse to have a test. And I think another thing that I want to point it out for the hereditary cancer control. I think it is, and I have a five important thing to do. The first one is the screening. The second is diagnosis, the correct diagnosis. And the third one is the treatment, personalized treatment. And the fourth thing is how to monitor the cancer that happen. That's very important. That's what I mentioned briefly. And the fifth thing is how to help the family to have a healthy baby, not allow the mutated genes to pass into the next generation. And according to the important thing to do. But genetic counseling is a bridge. It's very important. If you don't have a bridge, you cannot cross over and cannot go cross the river to go to have even though you have a very good seed, you cannot go to the other side of the river to put in the seed in the field, and so it cannot grow.
Excellent. Okay, we'll wrap that up for today. Thank you both very much for your time and for sharing your expertise and experience with us.
Thank you very much. Yeah, I have been working in the hereditary cancer field for a long time, and since I have a genetic counseling in 1996 when I was in the University of South Carolina. And after that, I once worked in the company and also worked in different school and hospital, especially at the MD Anderson Cancer Center. So I try to bring some information and some experiences that come back to China to do something.
Excellent. All right. Thank you very much.
Thank you.